Welcome to today's episode of Quick Medical Review, where we explore the diagnostic criteria for prediabetes, type 1 diabetes, type 2 diabetes, and gestational diabetes. We'll cover the why and how behind each diagnosis, from causes and risk factors to the key tests you need to know. Stick with us, and by the end of this episode, you'll feel more confident in identifying and managing each type of diabetes. Why does diabetes happen in the first place? Diabetes occurs due to problems with insulin. Either the body doesn't produce enough insulin, doesn't use it effectively, or both. This malfunction has different causes depending on the type of diabetes. Prediabetes and type 2 diabetes are closely linked to insulin resistance and beta cell dysfunction. Factors like obesity, physical inactivity, family history, and metabolic syndrome play a huge role here. Type 1 diabetes is an autoimmune disorder where the immune system mistakenly attacks the body's insulin-producing cells. It's often diagnosed in children and young adults, but can happen at any age. Gestational diabetes happens during pregnancy due to hormonal changes that make it harder for the body to use insulin. Obesity, older maternal age, and family history of diabetes increase the risk. How do these types of diabetes present? Here's a quick overview of how symptoms differ for each type. Prediabetes is usually silent. Most people have no symptoms at all. Type 1 diabetes usually presents with symptoms of frequent urination or polyuria, excessive thirst or polydipsia, weight loss, and fatigue. Type 2 diabetes often develops insidiously and can be asymptomatic. Patients can also develop symptoms over time like blurred vision, recurrent infections, and fatigue. Gestational diabetes typically has no symptoms, but may be detected during routine prenatal screening. If you're noticing a pattern, you're right, early detection is critical, especially for prediabetes, since it can progress to type 2 diabetes without warning. How do we confirm these diagnoses? Here are the key tests you'll need to know. HbA1c test is the primary test for diagnosing prediabetes and type 2 diabetes. A result of 6.5% or more indicates type 2 diabetes. However, it is not used for diagnosing type 1 diabetes or gestational diabetes. 2 HbA1c tests are required to diagnose diabetes in asymptomatic individuals, but only one test is needed to diagnose prediabetes. HbA1c cutoff for prediabetes is 5.7% to 6.4%. For type 2 diabetes, fasting glucose 7 mmol per liter or more confirms the diagnosis. Oral glucose tolerance test is the gold standard for diagnosing gestational diabetes. It is also used to identify impaired fasting glucose and impaired glucose tolerance. Diagnostic thresholds for impaired fasting glucose is defined by fasting glucose of 6.1 to 6.9 mmol per liter. Impaired glucose tolerance is defined by a 2-hour post-glucose load of 7.8 to 11 mmol per liter. Gestational diabetes diagnostic criteria vary by local guidelines. For gestational diabetes, the cutoff for fasting glucose is 5.6 mmol per liter or more, and for 2-hour post-load glucose is 7.8 mmol per liter or more according to NICE criteria. Each of these tests has a purpose, and knowing when to use each one is crucial. For example, if a pregnant woman's glucose levels are borderline, the OGTT will give the clearest answer. For someone with risk factors for type 2 diabetes, the HbA1c test is a fast and efficient option. Let's recap the key points. HbA1c is the most useful test for diagnosing prediabetes and type 2 diabetes. Fasting glucose and OGTT are essential for diagnosing type 2 diabetes and gestational diabetes, respectively. Each type of diabetes has different risk factors and requires a tailored approach to diagnosis and management. That's it for today's episode of Quick Medical Review. We hope you're walking away with a clearer understanding of the diagnostic criteria for diabetes. If you found this episode helpful, please share it with your colleagues and follow us for more educational content. For more in-depth reviews and updates, be sure to visit Quick Medical Review.